what are risk factors and protective factors for colon cancer? Because certainly if we can do something to protect ourselves, we want to be able to do something. So acquired risk factors include both dietary and lifestyle risk factors. When we think about these, I'd like to think about them as those that can reduce the risk of colon cancer, which would include exercise, vitamin D, folic acid, maybe dietary fiber, maybe calcium in women, hormone replacement therapy, as well as aspirin and NSAIDs, and we'll go into these in greater detail. But also, what could also increase the risk of colon cancer? These include tobacco, alcohol, and red meat. If we have to ask ourselves, I can't change my genes. I'm born with them. My mother, my father, maybe they gave me lousy genes. Maybe I'm at a 50% risk for getting these genes inherited, and maybe that gives me over my lifetime an 80% risk of developing colon cancer. But is there any way that I can actually still decrease my risk for colon cancer? There certainly are. So exercise. There are true studies showing the benefit of exercise. Studies indicate that 30 to 60 minutes of moderate activity decrease the risk of colon cancer by 30 to 40%. Now, what are possible mechanisms in this? It could stimulate motility of the colon. It could increase the activity of antioxidants. It could enhance the immune system. And perhaps just by merely reducing body fat, it could also play a role in decreasing the risk of colon cancer. Now, aspirin is actually quite controversial. There are multiple studies that have done short-term aspirin usage that shows that there's a reduction in polyp recurrence in patients with a prior history of colon cancer. Unfortunately, it requires a lot of aspirin to get this beneficial effect. So chemoprevention requires very high doses over a very prolonged period of time, and typically that's more than 14 regular strength tablets a week, meaning more than at least 2 regular strength tablets of aspirin a day. So that really raises the adverse event rate, such as gastrointestinal bleeding. So the United States Preventative Services Task Force believes that aspirin cannot be recommended for general use by a healthy population for cancer prevention. But that doesn't mean, certainly in patients that are taking this perhaps for cardioprotective effects, that it can't play a role in helping to prevent colon cancer development.